moved from the Home Office to Health, where it should be, but one does have to ask why drugs are being seized when this is no longer illegal drugs. That's what changed in November. In medicine, we use many controlled drugs. We use heroin, we use morphine, we use ketamine, we use diazepam that have a street value, but it has never stopped them being used in medicine. The problem is the way cannabis was treated for 50 years means we have had almost no research and almost no experience. And the problem is expectations were raised in November as if every GP would be able to simply write a prescription. But a prescription for what? It has to be a pharmaceutical quality of drug so that you know exactly how much CBD, how much THC you'd be prescribing. That is not yet generally available. And I think it is important that we are looking through the government to get pharmaceutical grade licensed with reliable formulations. This is under inquiry in the Health Select Committee, and we have heard from patients who were advised to go to Holland to get drugs, costing them £30,000 per visit, and that's unacceptable. The government will have to stimulate, and I'm grateful that calls for research are going to go out, but we need specialist centres in paediatric neurology for the children with epilepsy, we need adult neurology for multiple sclerosis, and we need pain specialists for chronic pain. Because these preparations are unlicensed, that means there's been no testing on their efficacy, meaning whether they work, and on whether they're safe. And that's something that is quite scary for doctors, particularly as if it's an unlicensed drug, they have to sign on the form to say they accept personal liability. And that is quite an intimidating thing, I can tell you, as I've done it. The government, therefore, does need to push for centres of excellence to help stimulate the research they say they're calling for, because this is the only way we will get randomised controlled trials and actually get answers to lead to these being licensed, not just a temporary fix for now.
Well, in